Conversations about pain and opioids are one of the most difficult in healthcare. One of the reasons for that is because they present us with a challenge and a dilemma. For decades now, pain has been the fifth vital sign, and we've managed that vital sign with medications as our mainstay. Now, we're trying to manage pain outside of medications. Relationship-centered communication can be one of the ways to manage that pain. In addition, it's how you bring up the conversation about pain in the first place. In this episode, we're going to explore the impact that pain and these conversations have on healthcare providers.
Our providers have a tremendous sense of empathy for our patients. Overall, they are challenged in that empathy with the many aspects of opioid addiction.
When people come to see me and we're discussing the reason for their visit, and immediately they zero in on the opioid pain medication, it invokes a sense of frustration and almost feels like I'm being taken advantage of.
It's very obvious there are times when people specifically come in wanting a pain medication or say that they can't find answers to their pain, and that's the next question from them is, can I just get a prescription to help me? So at times it makes you feel like the patient is at fault to a certain degree, label them as a drug-seeking individual, or maybe sometimes I'll feel bullied.
And as a physician, what I want to do is alleviate pain and suffering, not be somebody's drug dealer or pusher. Over the years, unfortunately, I've come to often regard patients in pain as suspect. As they walk in the door, I'm sizing them up, I'm looking at them, I'm making judgments about their appearance, about whether they're here for pain medication or not, whether they're legitimate, whether they're not. I even wonder if maybe there were some patients who appropriately needed medication that I was denying because I became so suspicious of all these patients and their motivations.
Years ago, before we had a really good understanding, I think we may not have had the empathy that these patients deserved.
We're constantly pushed to have a great patient experience, right? We want to have them walk out of our offices happy, and they are coming to us to fix their problems. They are seeking solutions for their problems, and to tell them that's not going to work or I don't agree with that management and to have that discussion is oftentimes a challenge.
I was probably getting fairly burnt out. I haven't been an emergency physician for that long to be burnt out. And I realized that many of my conversations with patients were frustrating, were around opiates, sometimes escalated into verbal arguments. I don't want to argue with patients. I don't want to fight with patients. No one ever feels good when you're finished an encounter and you just had a fight with somebody. It just takes a tremendous toll on the providers, physicians, nurses. There were folks, myself included, who needed a good 20 or 30-minute car ride just to get home at the end of a shift because we just felt had.
I hear from our staff the challenges they have and not being able to make an impact on their patients. I hear the loss of energy in our providers. I hear the challenges in dealing with this population.
As a healthcare provider, it feels very challenging when somebody comes to you asking for a narcotic because you don't necessarily know what tools you have available and what resources you have available to help you navigate that patient's condition or problem. I think that oftentimes that's why we just cave and prescribe. To be tougher and to say no and to offer solutions and alternatives, we need to have resources available to us for that patient.
The challenge and complexity I hear is our providers not having the tools that they need actually to understand and be able to deal with that situation in the room and in that one-on-one encounter with that patient.
As I've come to learn more about patients who suffer from substance use disorders, I now have a more empathetic approach to what it is that they're seeking and what it is that they really need for their improvement.
And I think the attitude towards these patients change over time. I can tell you in my 21 years as an orthopedic surgeon, I've seen it myself, I've seen it in my colleagues, and I've seen it in our professional staff.
It's a new perspective. It still requires, I think, a lot of discussion and a lot of understanding to recognize that these patients didn't choose where they're at oftentimes, and the pain that they're feeling is actually still real pain.
Conversations about pain often have negative impacts on healthcare providers. Because we feel less control in these conversations, we tend to dehumanize patients and stigmatize them with labels. This can create barriers to a therapeutic relationship and effective treatment. We need to have empathy and help our patients develop shared goals and expectations for their pain management.